Yeah. So a lot of kids have also been suggested by doctors. Like for example, I'll take my case. I also had PDA. So I was treated when I was in my, I think, eighth standard. So in some cases, doctors also recommend to, delay the procedure. After a certain age, they recommend that they will perform the procedure, and in certain cases, they suggest that it should be performed immediately. I think it's all based on the, like doctor said, that on the history and other details that you can explain better. So my question here is that does all defects related to hearts require surgery, or there are any alternative treatments that patients can seek, parents can seek for their kids?
So, Sunidhi, because you have mentioned your history, so I want to mention one thing why we are doing and why we have to do this meeting and this session, because there are a lot of myths about when is the right time to intervene. Okay,
Yeah.
so when to intervene, how to intervene, and what to intervene. Okay, that is very very important. And in all these things, most important thing when to intervene. Okay, that is still a big dilemma in general population, even in general pediatrician. Most of the general practitioners and general pediatricians are not aware of this thing. Okay, like you said, your PDA should be closed at the age of 6 months. Okay,
Right.
not at the age of 8 years. Okay, most of the PDAs at the age of 8 years become inoperable. Okay, so that is not right. Okay, so you ask about the all the cardiac, the congenital heart defect should be surgically treated or not. Okay,
Yeah.
right? So number one, how to detect? We have already discussed what are the symptoms. I think he has already enumerated
Yes.
what are the symptoms. Whenever you are able to diagnose or even able to raise a suspicion, if your
Hmm.
kid is having congenital heart disease, I think you should consult your pediatric cardiologist nearby. Okay,
Hmm.
and that center should have a good facilities for the pediatric echo and pediatric cardiac surgery. So the team of these pediatric cardiac doctors will take a decision, right,
Right.
about that, because we have got hundreds of diseases and every disease is different. Okay, there are some diseases they have to be intervened immediately at the time of birth. There are
Right.
some diseases they have to be intervened below 1 month of age. There are some
Hmm.
diseases they have to be intervened at 6 months of age, and there are some diseases in that we can wait. Okay, so
Right.
all the diseases are different basically. So, like left to right lesions, we tend to intervene early, like VSD,
Hmm.
PTA, coarctation, AV canal defects, and truncus. In these lesions, we have to intervene early. Otherwise, cyanotic congenital heart disease, we can wait a little more, maybe 1 year of age. But there are some diseases like TGA and TAPVC, we have to intervene in maybe neonatal age also.
Okay.
Yeah. So every
During
lesion.
the pregnancy period. Yeah. Okay.
One of the questions was ki every heart disease require surgery,
Surgery. Yeah.
and other one was ki if there is alternative treatment available
Right.
rather other than surgery. Hello.
Yes. Yes.
Yeah. So, yeah, smaller lesions, if there are smaller lesions like a small VSD or a small ASD, we can leave these lesions. They don't interfere with the general well-being of the patient. They don't interfere with the daily lifestyle of the patient. So we can watch them, we can follow them. So if the lesion is small, we can just see them again and again on regular intervals. These kids, they don't require a surgical or any other intervention if we are following it with the cardiologist. Other thing is, other than surgery, now we have developed in the cath lab, we can do devices to close these holes. We can do ballooning to open the valves. So this field is progressing very fast. So without surgery, we can treat these kids. We can close a VSD, we
Mm-hmm.
can close a PDA, we can close a ASD in the cath lab without any surgery, without any surgical
Right.
scar, and can discharge them early. So this treatment is also available depending upon the indications. there are certain indications for surgery, there are certain indications for device closure. Depending upon that, we can do both the things, and both have excellent results with its own advantages. Surgery has its own advantage, and device closures have its own
Okay.
advantage.
Yeah,
You're
and we
always
will
right.
be
That's
having a lot more sessions with you ahead, so that our
definitely.
audience will know and they'll stay tuned with us for more information like this. Thank you for joining
Right,
us.
Suniti.